and a rate increase of up to 60% right across the border in my home state of Illinois. 60% in 1 year. That's the future. That's the future if we fail to act. And by the way, I don't recall any of these Republicans trying to do anything about insurance companies' abuses during all the years they were in charge. Do you, Claire? I don't remember. I don't remember them doing anything about folks who needed some help when the government was running surpluses. So I get a sense with some of these folks, it's just never going to be the right time. But the truth is, we have debated health care in Washington, not just this past year, we've been debating it for 70 years. You know who was pushing health care reform? Harry Truman. Harry Truman was pushing health care reform. And by the way, you know what they said? They said he's pushing socialized medicine. Harry Truman. And over this past year, we've been talking about it. Every proposal has been put on the table. Every argument has been made. And everybody has made it. And I know that people view this as a partisan issue, but the truth is that if you set aside the politics of it and what was good for Election Day, it turns out that parties have plenty of areas where they agree. And the plan that I've put forward is a proposal that's basically somewhere in the middle. One that incorporates the best ideas of Democrats and Republicans, even though the Republicans have a hard time acknowledging it. Now, there are some folks who want to scrap the system of private insurance and replace it with a government-run health care program like they have in some other countries. We got some applause here. And look, it works well for those countries. But I'll just be honest with you. It was not practical or realistic to do here, to completely uproot and change a system where the vast majority of people still get their health care from employer-based plans. And on the other side of the spectrum, there are those who believe that the answer is to simply unleash the insurance industry and provide less oversight and fewer rules, and that somehow that's going to drive down prices for everybody. This is called the putting the foxes in charge of the hen house approach to health care reform. So whatever state regulations were in place, we'd get rid of those, and so insurance companies could basically find a state that had the worst regulations and then from there sell insurance everywhere. And that somehow that was going to be helpful to you. All this would do would give insurance companies more leeway to raise premiums and deny care. So I don't believe we should give either the government or the insurance companies more control over health care in America. I want to give you more control over health care in America. So my proposal builds on the current system where most Americans get their health care from their employers. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. But my proposal would change three important things about the current health care system. And I want everybody to pay attention. I know it's a little warm in here, but I want you to pay attention so that when you are talking to your friends and your neighbors and folks at work and they're wondering what's going on, I want you to be able to just say, here are the three things Obama's trying to do. First, it would end the worst practices of insurance companies. And it would begin to do so this year. This year. Thousands of uninsured Americans with pre-existing conditions will be able to purchase health insurance for the very first time in their lives or since they got sick. This year. Insurance companies would be banned from denying coverage to children with pre-existing conditions this year. Insurance companies would be banned from dropping your coverage when you get sick. Insurance companies would no longer be able to arbitrarily and massively raise premiums. They would be subject to review. Those practices will end as a consequence of health care reform. All new insurance plans would be required to offer free preventive care to their customers. And if you buy a new plan, there will be no more lifetime limits on the amount of care you receive from your insurance company. All that fine print that ends up getting folks into trouble. If you're an uninsured young adult, you'll be able to stay on your parents' insurance policy until you're 26 years old. So a lot of folks, as they're transitioning into the workplace, will have insurance. All right, so that's part one of the plan, insurance reform. Part two, for the first time, uninsured individuals and small businesses will have the same kind of choice of private health insurance that members of Congress get. If it's good enough for members of Congress, it's good enough for the people who pay their salaries. Now, this should not be a controversial idea. The reason that federal employees usually have pretty good insurance is because they're part of a pool of millions of people. So what happens is they can negotiate for really good rates because the insurance companies really want those millions of customers. So what we're talking about is setting up a pool for people who don't work for the federal government. You, individuals, small businesses, they can be part of this pool. And this is an idea that a lot of Republicans embraced in the past until I said it was a good idea. Suddenly. So all this would drive down rates for those individuals and small businesses who aren't part of a big company that get good rates. And my proposal says if you still can't afford it, even though now the premiums are lower than you can buy on your own, then we'll offer you some tax credits to make it affordable. And those tax credits would add up to the largest middle-class tax cut for health care in history. So, it's estimated that this would drive down the costs for folks who don't work for big companies, so they don't get as good of a deal, by 14-20%. This is before the subsidies, before the tax credits. Now, it's true that this will cost some money. It's going to cost about $100 billion per year. That's real money. That's a lot of money. But most of that money comes from the nearly $2.5 trillion a year that America already spends on health care that we're not spending well, that we're spending badly right now. So, we pay for this proposal by getting at the abuse that we just talked about. We eliminate wasteful taxpayer subsidies that go to the insurance companies. Do you know that through the Medicare program, we are giving insurance companies close to $20 billion a year?